Hey everyone, good to be with you. I'd say good to see you, but you know, I can't. You can see me. I'm assuming all of you have bodies. You're not just, you know, random Autobots that populate, you know, things and questions. But boy, that would be a good existential OCD thing, wouldn't it? There. Hope everyone is doing well today. I don't know that I've worn a hat much. I'm thinking now. It was a hat day. It just was. You know, some days are hat days. Today was a hat day. So yeah, here we are on a Wednesday hat day. Let's enjoy for a moment. Thank you all for being here. And as usual, let's jump right into some of our questions. Richard says, "Good evening. Last week you mentioned how you're refusing to do compulsions more aggressively." Awesome. OCD is now bringing more complex tricks. Yep, it does that. The tricks come to your brain almost every second, all day long, probably like a 10-second break every minute. Is this normal? So everything's normal in OCD, right? just keep that in mind. Everything is normal in OCD, right? Nothing to me is unusual in OCD. So when someone says, "Is this normal for OCD?" Yeah, sure, why not, right? OCD doesn't have an abnormal by any means. OCD just tries to figure out ways to get you to give in, right? So whatever those ways might be, that's what it's going to do. It's going to try to get you to give in, right? Just always remember that, right? So I think sometimes people drive themselves a little over the top by trying to think about, oh, is this normal or is this not normal? It's all normal for OCD because OCD has no bounds. So everything falls in the realm of something that OCD can potentially do to try to get you to do a compulsion so that you can neutralize that obsession, and then you get that immediate gratifying relief for a little bit, but then you've got to start all over and do it all over again. Okay. August 8th says, "Thanks for the weekly videos." Wonderful. Yeah, thank you. It's helped you a lot. Awesome. Your question is that you live with 2 female roommates and you share a bathroom. I bet I know where this is going. There's probably some semen coming up here, everyone. So you're afraid that by using the bathroom, or touching items in the kitchen table, fridge, doorknob, anything like that, you'll contaminate with semen. I knew it was coming. So the compulsion has been to wash your hands dozens of times, literally with anything that you do, or to disinfect those items or areas that you touched in order to prevent your roommates from becoming pregnant, which you don't want that to happen, of course. Any thoughts or suggestions on how I should handle this OCD thought? Thank you. Yes, very, very simply, you handle this by not doing the compulsions anymore. That's what you do. It is not about making the thoughts go away. It is about sitting with the discomfort of the fact that those thoughts are popping into your head and not doing anything about it, and allowing yourself to recognize that just because your brain tells you that does not actually make it true and cause anything to happen whatsoever. So I hope that that makes a lot of sense, right? I really do hope that you all get that really, really well right now, that you can sit with whatever a thought is and you can handle it, right? So just because you think sharing a bathroom might make somebody pregnant would mean that pretty much every family that lives together would have caused pregnancies to every family member, right? Every male would have impregnated every single female if this was the case, August 8th, and if it worked the way that your OCD is telling you that it would work, right? So it would mean that anytime that you go to a job and there's shared bathrooms, that women would just get randomly pregnant from touching the sinks or the toilet, right? Or doorknobs or anything of that nature whatsoever. I've treated women who are afraid to sit where men have sat in case they leave a little deposit on the seat and something likes to crawl up inside. I've treated men who are afraid of what if they leave a little deposit on the seat and then a woman sits there and things crawl up inside, right? And so far, of course, science has not shown any of this to actually work this way whatsoever. And yet, we have OCD telling us, oh, well, I know more than science does, right? I am smarter than science. I, OCD, have figured out all of the potential awful, bad, horrible things that could be occurring and know that you need to be thinking about them and worried about them because what if, right? There's our favorite phrase, everyone, coming back again. What if it were to happen? What if your roommates became pregnant and you became a father of a child that occurred out of wedlock and was not wanted by anyone because someone just was trying to go to the toilet and no, you caused them to become pregnant. Now, of course, when I say this out loud, all of you think, well, that, of course, is ridiculous, right? It doesn't work that way. But remember, everybody, remember this. Just because it doesn't work that way doesn't mean that OCD won't try to convince you that it could work that way. Okay? And that's what OCD does. It says, well, sure, there's no evidence of it, but what if? Right? But what if it were to be that way? Wouldn't that be awful or horrible? Shouldn't we make sure that it doesn't ever happen like that? And wouldn't it be best just to wash your hands and your genitals and anywhere that you've touched just to make sure that there is no semen there? I mean, OCD gives the guilt trip, right? It's like, hey, you have a chance to make sure 100%, parentheses, even though I'll never accept it to be 100%, it'll be like 99.999, and that'll never be enough, but I'll continue to torture you for the rest of your life about it, but go for it and try to get the 100%. Anyway, close parentheses. And now you've got to do everything that OCD wants you to do. That's the way it works, right? That's how it goes. So you could try to prevent this from happening for the rest of your life. And other people will not try to prevent this from happening for the rest of their life. And the results will be identical. No one will get pregnant from a toilet seat or a doorknob or a faucet or anything like that. But remember, your OCD will say, but you're special. I treated someone with this one time and after, we had a really good relationship. So after a while we talked about, oh, wait, if you have super sperm, maybe they can do things that no other sperm do, right? And, you know, he got to the point after a while, I'd be like, well, I'm still afraid the super sperm, you know, but I realize I don't have super sperm, right? I just have regular old sperm just like everybody else does. There's no such thing as the super sperm, right? That live forever and cause pregnancy in anyone who's within a 5-foot radius of them or something of that nature. It just doesn't work that way. So going back to the earlier thing, you know, what's normal or abnormal? Well, in OCD world, you know what's normal? I could sit on a toilet and maybe a sperm would come out of me and maybe it would land on the toilet seat and then maybe a woman would sit on it after me and then maybe that sperm would find a way to crawl up inside of her and get her pregnant and maybe then I will 9 months later be a father and not even know that I'm a father, and this woman not even know who the father of her baby was. It'll just be a miraculous kind of conception to her because she won't potentially have ever even had sex, and she will become pregnant, and no one will ever know the wiser. What if that were to happen? Well, that's just overwhelming to think about. So maybe it's just best that I wash everything down to prevent it from ever happening. Now, again, we see the level of OCD ridiculousness, right? And yet, when we're in the throes of it, it doesn't feel ridiculous at all, does it? It feels so real, which goes to things we talk about here almost every week. Why does it feel so real? Well, it has to feel so real. It wouldn't be a problem if it didn't feel so real, right? So it's going to absolutely feel so amazingly real to you. And it's going to drive you to do those compulsions. And when you do them, you're going to feel such relief after doing it, right? Not that you're going to feel great after doing it. You know, that's a different kind of feeling. You're going to feel relief from that obsession after you do it. And that's going to last just for a little bit likely. And then you're going to have to start it and do it all over again. And over and over and over. Okay. Now, tonight's webinar brought to you by NOCD. NOCD, a downloadable app you can get through Google Play or iOS. So please run right over to your phone if you're not on it already, which, let's face it, most of us are all the time. But if you're not, check us out. And we have teletherapy across the US, and we're in the UK and Canada and Australia. So please feel free to reach out to us at NOCD. You can go to www.nocd.com. You can go to us through the app. We are available, and we've got a team of people waiting to chat with you, to do a free 15-minute call with you to see what's going on and to set you up with one of our very well-trained exposure and response prevention OCD trained therapists. So check us out. We'd love to chat with you. All right, Richard, you get one more question, and then moving on. Another question, if you may, you can. I can't sleep at night because of the moderate anxiety. Again, even if no compulsions are done, I watch videos of dogs reacting to lemons, okay, just to deal with the anxiety. Well, Richard, that's distraction, and maybe that's why you're feeling anxiety still, because you're trying to distracting. And then here, look, you say right here, I'm distracting OCD. I just can't sleep. Any advice on how to deal with anxiety that keeps you up? Yes. You might have a couple of sleepless nights, right? There might be a few nights where OCD is going to be really screaming and screaming at you. But eventually it fades as long as you don't give in to the distraction. So here's what I want you to do, Richard. I really do want you to sit with the discomfort. I really do want you to be able to be with it, right? And recognize that you can handle it. You don't have to give in to the distraction, right? Your OCD wants you to. Your OCD is going to want you to do whatever that you possibly can to do as a compulsion, right? To neutralize this in some way, shape, or form. I want you to sit in the discomfort, Richard. That's what you're going to have to do. Well, and boy, I still have to change my wording. I want you to live with the discomfort, Richard, right? I want you to be able to live your life with the knowledge that it is okay to be uncomfortable, okay? No one is without discomfort. I know absolutely no one who has zero level of discomfort in their life. We all experience discomfort. It's a natural part of life, right? There's no reason to try to make all of it go away. You can learn how to handle it. And you might even say, well, I can handle most of it, but I can't handle the OCD one. And that's the OCD lie trying to tell you that you can't handle it, when the reality is you absolutely can. You can sit in that discomfort if you choose to, right? You can live with that discomfort if you choose to, right? Think of all the people who live with chronic pain and still go out and live their life and do the things they need to do. Think of people who live with all sorts of changes in their life, right? Maybe they've gone blind in one eye. Maybe they've lost the use of a limb or limbs. Maybe they've lost limbs. And they figure out how to live with the experience of it. And we might say, well, that's different, right? Yeah. But the reality is, if someone can learn to live without a leg or an arm or an eye or the use of an ear for hearing, someone can also live with a sound like tinnitus, or an image, or an urge, or a thought as well. I don't know anyone who is immune to intrusive thoughts or intrusive images or intrusive urges. I know absolutely no one who is immune to those things. For those who have OCD, the notion is I should be immune to this. And for those who don't have OCD, it's, oh, that was weird. Okay. That might annoy me for a while. All right. Okay. All right, let's see who's next. Mez, hi. He says, hi, Patrick. Hello, Mez. I've been struggling with SOCD, so sexual orientation OCD, for the last few months. And on top of that, your brain is obsessed with people's names, people you work with, names on TV. It is constantly on repeat subconsciously. Is there a reason why this happens? And is there anything I can do about it? Well, Mez, I'm wondering what you're doing about it now. If you're trying to give in to remembering names and challenging yourself to test if you know a name or not know a name. Mez, one of my favorite exposures in a situation like this might be to purposely call somebody a wrong name, right? And then just live with the fact that you've done that. Sit with that discomfort of having done such a thing, of purposely calling somebody a wrong name, right? That would be really good to do from an ERP standpoint. Now you might say, oh, but isn't that mean and awful and horrible to call somebody a wrong name? I'll tell you this. I was with a bunch of friends over the weekend, and we're just all sitting around a table, and you're talking to Joe, and then Tom's over here, and it's like, hey Joe, I mean Tom, we that happened all weekend long, especially as all of us continue to get older. We're lucky, it's just like, hey, jerk face or whatever. We're lucky we even know each other's names sometimes. So I challenge you to do the thing you're afraid of, to sit with the discomfort of it and learn that you can handle that very thing, right? Live with that discomfort. Be in that discomfort, right? We're hearing that a lot tonight. How is it that we can be uncomfortable and recognize that we can handle being uncomfortable, right? How is it that we can allow ourselves to let go of whatever it is that is in our head? Well, we can do that by purposely exposing ourselves to situations that we're ultimately afraid of, and show ourselves that when we do those things, it's actually not so bad. Nothing really actually occurs in those situations. Give it a go. I'm going to bet what almost everyone discovers when you do the rule of opposites. Well, a buddy of mine, Dave Carbonell, great therapist, and now a improv actor as well, talks always about this idea of the rule of opposites. How do you treat people who have anxiety and OCD and everything? You have them do the opposite of what they're inclined to do. And if they're inclined to do safety behaviors, you have them do the opposite of safety behaviors, because those safety behaviors are immediately gratifying and yet don't serve people very well in the long run. If they did, OCD therapists would be teaching people how to do safety behaviors. We would be teaching people to do all sorts of things like avoid and seek reassurance and distract and all of that kind of stuff. But it turns out that's not what we do. We do the opposite of that. We teach people to run toward the anxiety, to be in the discomfort, to live with the discomfort, to handle it, and to be able to just make it a part of life, right? I mean, again, I'm assuming no one listening tonight is 100% comfortable. I'd also assume that if all of us were in a circle and one of you was talking about your OCD, someone else would think to themselves, geez, I wish I had that kind of OCD. That would be so easy to deal with. Now, the reality is almost all of you would think that anytime anybody else was talking. Why? Because you're not bothered by that thing. That is not on your radar, that thing. The thing that's on your radar, that's the thing that bothers you. Anything else? That's no big deal. Right? When COVID came out, I talked to so many people who had OCD, and I was like, how are you dealing with COVID? And I don't care about COVID. I'm afraid that I ran someone over with my car. I care less about COVID. Okay. Right. So your thing is your thing. Right? That's what it is. And you may see other people's thing on here and think, I don't understand why anybody would be afraid of that. Ultimately, OCD picks what is most important to you, and that's what it gets you to fear, right? That's really what it is. So for one of you, it'll be, I've left semen on a toilet seat. For another one of you, it will be, I can't get this thing out of my head and I need to do avoidance behaviors, right? For one of you, like Anna here, it says, real event OCD, your past mistakes are way too horrible, like very bad, please help. Anna, I'm going to bet that your OCD tells you that they are very awful and horrible and bad, but if other people did them, the likelihood is you probably wouldn't judge them nearly as bad or awful as horrible as you judge yourself. Why? Because we think we're special and we set a different set of rules for ourselves than we do for everybody else. It's fine if anybody else were to do that, but the fact that I've done it makes me awful and horrible and disgusting and gross and whatever else it may very well be, right? That's what we see all the time in these kinds of situations. Reminder, tonight's webinar brought to you by NOCD. NOCD, a downloadable app you can get through Google Play or iOS. Check us out at nocd.com. We would be more than happy to talk to you for some teletherapy if it's something that you're looking for. And hey, if you got friends or family or relatives or anybody looking for us, check it out. Tell them to go to that nocd.com website and take a look at us. We'd be more than happy to chat with people. Let's see. So Sarah says, when my anxiety is calm about false memory, intrusive thoughts, you still feel fear about disgust, worry, and paranoia. You get depressed and try to live normally, but the intrusive thoughts have left a big scar. How do you deal with thoughts like you don't have OCD, you're getting away with something? Why intrusive thoughts make you doubt so much when you know it's false? Please explain. It all goes back to the two words, Sarah, that we've talked about earlier. And those two words are, but what if? OCD doesn't care what you know logically, right? Because OCD is not a logical problem. OCD cares about how you feel emotionally. And OCD can really screw with your emotions with two words. And those two words are, what if, followed by the worst case scenario that you can possibly think of. Okay? So we're not here to convince you, Sarah, that your memories are true or not true or anything like that. We're not here to tell you that your intrusive thoughts are right or wrong or anything of that nature. We're here to get you to recognize, Sarah, that you just don't need to pay all the attention that you are to all of these things. There's just no reason for it because you're never going to get anywhere with it. No one with OCD in the history of OCD has ever come to a point in thinking about OCD where they've said, oh, you know what, I've thought a lot about that now and I finally figured it out. Everything's great. Goodbye, OCD. That has never happened. That is never going to happen. It does not work that way. It is a waste of time to hope for that to occur. Okay? But OCD sneaking and says, but maybe for you it could. Maybe you could actually get to that point. And wouldn't it be best just to do something and try just a little bit harder, just a little bit more, right? It's why I've talked about, OCD is kind of like Lucy holding the football for Charlie Brown to kick. And Charlie Brown every time sees Lucy holding the football and thinks, maybe this is the time. I'm going to sneak up on Lucy holding that football right there. She's not even going to hear me running. She's not even going to see me. And I'm finally going to kick that football. And just as Charlie Brown goes to kick it, Lucy goes, whoop, picks the football right up, and Charlie Brown goes flying through the air doing his, ah! and crashes on the ground. Right? And then my favorite line, of all the Charlie Browns in the world, you're the Charlie Browniest. Right? So was Charlie Brown ever going to kick the football? No. Even Charles Schulz, writing about Charlie Brown, said Charlie Brown was never going to kick the football. Lucy was always going to pick the football up. Guess what? OCD's never going to let you kick the football. OCD's always going to pull the football up, and you're going to go flying through the air and land on your back and be like, ugh, darn it. I tried. Well, just try one more time. Hey, look, I'll hold the football for you again. Maybe this will be the time that you'll actually be able to kick it. Right? Well, if any of you ever do that, write to me, and we're going to write a book together, and we're going to make millions of dollars, because we're finally going to come up with a cure for OCD where someone will be able to finally say, hey, I kicked it. OCD is never popping up ever again in my life. I will never have another intrusive thought, image, or urge, which, by the way, even people without OCD, every one of us in the world without OCD has thoughts or images or urges that we find intrusive or inappropriate or gross or disgusting or shameful or guilt-ridden or whatever it might be. So the entire human condition is to experience these types of things. But again, OCD says, yeah, but I'm special and I shouldn't experience it even though everybody else in the world does. It should be different for me. And that's just bullcrap, right? That it just is wrong. That's not the way that it works. No one is immune to a thought that they don't like. The whole world experiences thoughts that they don't like. It's a normal, natural kind of thing, right? They just happen. You're never not going to have thoughts that you don't like, or that you don't find weird or odd or gross or disgusting or shameful or anything like that. So that is not the goal. It ought to never be the goal, because it's an unattainable goal. And why would we ever want to have a goal that's unattainable and that be the goal that we're working toward? I mean, it just makes no sense. Hey, welcome to college. We're glad you're here. You know, you're never actually going to graduate, but keep coming to class and keep trying. Right? Hey, welcome to work. You know, we're never going to give you a paycheck, just so you know. But keep coming, because maybe one day we will. But we're not. Just so you know. But maybe one day we will. But it's never going to happen. But it might. But it won't. And that's what it's like, right? And you can hear those examples and go, well, it'd be stupid to go to a college that would never give you a degree. Why would you ever go to work to never get a paycheck? Why would you listen to anything OCD said? Just it's futile, right? But OCD has that thing where it hooks onto that emotion, and that emotion feels real. And boy, you know, it must be true, because why would I feel this way if it didn't feel? Or if it wasn't true, right? It's got to be true. I can't feel like this without it being true. Well, you can. You absolutely can, right? I've given this example before. If you go to horror films and you jump in your seat, you've just paid money for somebody to scare you for something that isn't actually true or real or happening. It's just a picture on the screen. It's not real. And you're like, ah, you know? So a horror film scaring you is fine. But a thought in your own brain scaring you, nope, unacceptable, can't have it, bad, awful, horrible, gotta go, must never happen again. Why would that occur? There must be a reason. Maybe I like it, maybe I want it. What does it say about me? Oh gosh, I'm a horrible, awful person. I need to be punished. I need to atone. I need to do all these things to neutralize that, because if I don't, then it means that I've accepted that and then I wanted that. And what if I really do accept that, or if I want that? What kind of person would I be in the world? And now I can't let that happen, because I can't be that kind of person. So I better darn well do anything that I possibly can to absolutely neutralize this, or else. What does that say about me? I hope that makes some sense. Hope that works for everybody. I'm going to put my specs on, everyone. You know, the eyes get a little old after. Whew. Look at that. Clarity. What do you know? Kaylee says, oh, thank Kaylee. Look at that. My rational and OCD brain bicker back and forth all the time. Yes, they do, don't they, Kaylee? Our goal is to not have necessarily either one win, right? Because we're not here to try to get somebody winning, right? We're here to be able to say, hey, you two, shut up in there. You're going to have to learn to live with each other. Just like if you've got a little brother or sister that are fighting with each other and you're the parent, and it's not going in there trying to, all right, let's see which one of you actually won this argument or anything. Because as parents, you've probably realized, oh, that's just dumb. What are you going to do? Hey, knock it off, you two. This is a stupid discussion and there's no reason for it. Let's move on. Well, that's going to work a little bit better with OCD than attempting to come up with a winner, right? Because no one really wins when they do what OCD wants them to do, right? Let's see. Lex says, I originally thought I had RFID. RFID would be a restricted food intake disorder. But the more research you do, it seems contamination OCD is your main issue. What's the first step you can take at home to help with all the contamination OCD intrusive thoughts? Well, Lex, first of all, feel free to reach out to us at NOCD. Download the app at at Google Play or iOS, or go to NOCD.com, because we can help you with RFID issues. We do treat that as part of the OCD condition. I think the first step that you can do, Lex, is sometimes what I've even done is little micro bites with people, right? Sometimes it's even smelling a food that you're having trouble with because you think it might be contaminated. And then it might just be putting it in your mouth and letting it sit there for a while. And then you can even spit it out after a while. And then eventually chew it. And then you can spit it out. And then chew it and swallow a tiny little bit and sit with the discomfort and everything that's there and allow that to pass. And then go to bigger and bigger chews and bigger bites, and then swallow the food and sit with the discomfort. And over time, let's see what happens, right? See how it goes. Emma said, last week I said you could email me questions. Yes, do you think you'll be able to answer them? I will try to, but I usually will try to answer them here on this program, if at all possible. So Emma, I will check out that, or if you could, Emma, email me again, and I will try to get to that for you. Sale agent. Okay, your problem at the moment is that you think you have to do the check on the imagination, and sometimes the imagination feels neutral even if you didn't enjoy it, for example with harm OCD. So the more you attempt to check things, the more you're doing a safety behavior, the more you're feeding into what the OCD wants you to do, and that is where the problem lies, right? When you do what OCD wants you to do, you are giving in to OCD, and you are basically saying to OCD, hey OCD, you are correct, right? I love you, OCD, and I'm going to do everything that's there. I'm sorry, I'm just looking up. Emma did send me a question. I'm going to read it in a minute, Emma, so I'll get to it. So sale agent. Your goal here, right, is to stop the checking. That's what you need to do. You have to sit and live with whatever your imagination pops into your head. Now, sale agent, I have not seen you on this webinar before, so you might not have heard my example, but it is a possibility sale agent. And those of you who've watched this webinar know where I'm going here. Right? It is a possibility sale agent that I will leave this webinar at some point in time with a Molotov cocktail, which I will throw at my neighbor David's house, setting it on fire. Then I will go into the middle of the street, poop in a bag, and then I will light that on fire, putting it in front of my friend Josh's house. And then I'll ring the doorbell, he'll come out, he'll stomp on it, and he'll get fiery poop on his shoe, and I'll laugh at him hysterically. And then I'll shoot a couple of geese that are flying over my house because I got a big pond behind me. And then I'll come back and I'll finish the webinar. Now, sale agent, that's quite an imagination there, wouldn't you say? What should I do, sale agent, to neutralize that? Or can I just live with the fact that I just said that out loud and I'm not going to do anything to neutralize it whatsoever? And I'm going to live with the fact that it is a possibility, even though a low probability. But Dr. McGrath, if something is a possibility, doesn't it make it highly probable? No. But OCD says, yes. Absolutely, says OCD. Anything is possible, and therefore everything is highly probable. But that's just not the way that it actually works. Just because there is a possibility does not mean there is a high probability. Okay. I mean, there's always a possibility some of us could get some very weird kind of disease, even if the probability is only 1 in a million, right? And when you have OCD, it's like, oh, well, that's way too, that's way too scary. 1 in a million, it's probably going to be me. I better do everything I can to prevent that from actually happening. Well, if that's the case, all of us should be locking ourselves in a panic room and, you know, making sure that there's HEPA filters everywhere with purified oxygen to breathe. Things happen. Life happens. OCD is not the thing that's going to start or stop it. Yeah. Just because you do compulsions doesn't mean that it prevents something from happening. Okay. Emma says, thank you for doing those webinars. How can I tell the difference between my thoughts and OCD thoughts? I'm newly diagnosed and still don't understand what thoughts are what. Diagnosed at the end of September. This is overwhelming at times. Thanks for any advice. Well, Emma, to me, the biggest difference that you're going to recognize is this. If a thought leads you to doing a compulsion, that's an OCD thought or image or urge. If it doesn't, it's probably not OCD. So you can start there, Emma, and see where that goes. And then when you notice that things pop into your head and they lead to compulsions, those are the things you have to tell your therapist that you're doing. Because then your therapist can work out some specific ERP experiences for you around those things that are leading to compulsions. So Emma, that's what I really want you to focus on is writing out a list of what are the thoughts or the images or the urges that are popping in my head that are leading me to do compulsions. That's what I got to share with my therapist, because that's what has to be a part of the treatment that I'm going to go through. That is how I'm going to get better. I'm going to be open and honest about those thoughts, those images, and those urges, and all the compulsions that they lead to. And I'm going to share those with my therapist so that we can develop some ERP so that I am not plagued by those anymore. Okay? That's what you need to really, really do. Jeannie says, what are other OCD CBT therapies besides ERP? Your son won't do ERP, so now you're trying to find him other therapies. I mean, Jeannie, the problem with that is that's a lot of talk, right? And so I would potentially work on what can you do to motivate your son to do some ERP, Jeannie. And I'm wondering, and I don't know, and I'm not going to make assumptions here, but I'm just wondering how many safety behaviors are potentially being provided to your son if that's the case. So, Jeannie, I want you to really pay attention to what would happen if you started to remove safety behaviors. Would that push your son into doing some ERP work, right? Even without necessarily having him purposely do it, but kind of in a back end, having him do ERP by you starting to remove some of the safety behaviors that are going Elizabeth, another about her son, says, I'm new to this. I'm wondering how I can best help my adult son who calls and texts me frequently looking for reassurance. How do I best respond to his reassurance questions? Elizabeth, one of my favorites is to start a worry journal with someone. And the best thing I think that you can do in that kind of situation is, if your son texts you a question that you've already answered, I think your response should be, that is in the text history, already answered that one, not going to discuss it again. And you don't talk about anything that you've already given reassurance to. So Elizabeth, that's going to be your first best bet right off the bat, is to do something like that. And just to let your son know, I'm no longer going to be providing reassurance to you about things we've already discussed. Now, if it's something brand new and you want to ask me a question, I will give you a one-time answer. And after that, if you ask it again, I will go back to, that's already in the history, just scroll back, because I'm not going to talk about it again. That's going to be a start, Elizabeth, and then hopefully something that will start to motivate him to want to get some treatment, because you're going to pull away from being the provider of the reassurance in his life that he's looking for. Tonight's webinar brought to you by NOCD. NOCD downloadable app, Google Play, iOS. Check us out at NOCD.com. Teletherapy all over the US, Canada, Australia, and the UK. Aaron says, hey, Dr. M, any Neil Peart lyrics for us? Well, Larry, who I believe is listening, hi Larry, who I work with at NOCD, laughed at me today because I did quote a Rush lyric in the middle of a meeting today. So I will use it from one of my favorite songs, Prime Mover. From the point of conception to the moment of truth, at the point of surrender to the burden of proof, from the point of ignition to the final drive. The point of a journey is not to arrive. Anything can happen. I hope that's helpful. I hope that's helpful for sure. You know, and thank you for the woohoos and the yeses there. One of my favorite songs. Check it out. It's called Prime Mover from the Hold Your Fire album by Rush. So, Chemical W6 says deep. Chemical W6, are you from Ireland? You mentioned Ireland there, so I'm just curious. Paul Melia, by the way, our theme song writer that you hear, hey, Hold On to the Colors, is from Ireland. So, and Patrick McGrath is a wee bit Irish. In fact, just a funny thing that is interesting. Oh, you are from Ireland. I'm looking back at one of your own things. When I've been in Ireland, you know, people will say to you, what's your name? And I'll say Patrick McGrath. And they'll say, wow, that's a really Irish name. And I say, yes, we still use them in the United States. We still use the Irish names. So that's always been something funny that I've seen happen in Ireland. Kayla says, can anyone describe this horrible feeling of a heavy chest by the heart, and then your head feels pressure, and then you feel horrible? Kayla, some of those could be symptoms of panic, right? So very, very common. In fact, I have recently been doing some talks about making sure that when we're treating people with OCD, we take a look to see if there's some panic symptoms that occur as well. Because sometimes OCD is sneaky. And one of the sneaky things OCD does is says, wait a minute, if you don't give in to this compulsion, I'm going to give you a panic attack. And that feels like crap. You're going to feel awful and horrible. Your chest is going to hurt. It's going to be hard to breathe. Your head's going to feel heavy. You're going to feel dizzy. You're going to feel lightheaded, discombobulated. You might feel detached from yourself or from your environment, maybe even detached and subdivided in a mass production zone. Another Rush lyric for you there, just so you know. But it is always, you know, possible that OCD uses the allure and the fear of the panic experience as a reason why you should be doing compulsions, because if you don't, we're going to give you a panic attack. So Kayla, I would recommend that if you're working with a therapist, you do something called interoceptive exposures. The interoceptives are exposures purposely to uncomfortable physical sensations that you might experience during a panic attack, like running in place or hyperventilating or breathing through a straw or spinning in a chair and or shaking your head back and forth or things like that. And when you do those things, you kind of train your body to be okay with the uncomfortable sensations that you might experience during a panic situation. And then you're not beholden to the OCD threat of panic on you anymore, because you've taught yourself how to handle panic, and OCD can't use that against you ever again. So give that a try. Okay. Back to the names. Kaylee says, my mom has 6 kids, so she calls us different names every time. Yes, my grandfather used to do that as well. So I've definitely seen that happen. All right, let's go through. Adem says, hi, Dr. McGrath. How do you deal with cheating OCD and not seeing your partner attractive and picking up fights with your girlfriend? Well, that could very well be some relationship OCD. And one potential thing might be that you're trying to test her to see if she's going to stick around or not. And this is the sneaky, again, thing of OCD. All right, if I can test you to see how many fights you put up with, and you still stick around with me, then you must think this relationship's good. But if I keep picking fights on you, eventually decide you're out of here, you're not going to have this, well, then maybe the relationship was never meant to be, because it looks like you weren't going to stick around anyway. Well, the reality might be, I think everybody potentially has their breaking point. And if every day I'm picking fights with someone as a way to test them to see if they're going to stick around, after a while, it might just be like, listen, I could probably find someone who isn't going to do this, and I can have just a great relationship and loving time with them without somebody constantly pushing and shoving at me to see if I'm going to fight back. So this is the interesting piece. Sometimes OCD is trying to create the very thing that it fears to prove to you that, look, see, I told you, I knew that was going to happen. I predicted that one. There it is, right? Be careful of that, right? Watch out for that. That can happen. M says, can OCD cause suicidal thoughts due to an overload of anxiety and depression? Sure. There's research that shows people with OCD potentially have higher suicidal ideation experiences than people without OCD, right? And why might this happen? Well, if you go back quite a while ago, the World Health Organization called OCD one of the top 10 most disabling disorders in the world. And so people who are feeling very overwhelmed and very disabled will at times have suicidal ideation. Now, there's also suicidal thoughts that are OCD based, right? The what if I were to harm myself, and maybe I should hide all the knives to make sure that I don't have any in the house so that I don't accidentally kill myself or something like that. So you can see it in 2 ways, right? OCD can also be very much associated with depression, and we know with depression there can be suicidal thoughts as well too. So there's a third way. So there's opportunities here with suicidal ideation to absolutely occur, right? It could be the OCD feels so overwhelming and people feel like maybe that's just the only way out of OCD. We hope that that's not the case, and we hope that they'll utilize therapy and get help wherever they can. If it's with NOCD, great, but if it's with someone else, awesome, right? Just we want people to get the help that they need so that suicide isn't the option for them to deal with their OCD. Suicide could again be the theme of OCD, of what if I were to harm myself? And then if there's associated depression, you might have suicidal thoughts due to the associated depression that people may experience as well. Okay. Erased Ability says, you're looking forward to reading my second book, the OCD Answer Book, I would assume. So available on all sorts of online retailers, OCD Answer Book. Do you have tips to tweak ERP to push SUDS up? So SUDS being subjective units to stress, the anxiety rating, the 0 to 10, or however you use it. Some places use 1 to 7. I know what my theme is, but doing my exposures doesn't bring up SUDS. So Erased, I would say that this is where you want to really take a look at this idea of maybe bringing a therapist in, right? If you're having trouble bringing up all sorts of ideas about how to get your SUDS up, utilize a therapist, because that's what they're really good at. I mean, that's part of their job to really, really help push you and challenge you and sit with the discomfort of things, right? So if you're not able to do it on your own, I'm hopeful, really hopeful, that you'll find someone who can help guide you to do that, right? That's what I would hope for you. I'm having bad words I don't like to use and don't like people saying them, and I get panicky. What can I do about this? I treated someone with this one time, and boy, I'll tell you, one of my more favorite ERP exercises that I ever did. It was with a youngster who wouldn't even use what could be considered a swear word in other words. Like hello would be beepo, because he had to beep out all of the swear words. And helicopter would be beepcopter, and dictation was beeptation, and asphalt was beepfault, and all those kinds of things. Harassment was herbeatment, and so, with Mom's permission, my colleagues and I all got around, and boy, this was 20 years ago, all got around a tape recorder with an actual cassette in it, a loop tape, and it was a minute long. And for 1 minute, all of us threw out every worst swear word or phrase we could possibly think of. We just went around in a circle, and everybody just would say one, and we just kept going for an entire minute. And then we sat in a room with him and just played that tape for hours at a time. And after a while, he was not at all distraught or bothered by those words, right? We even had Mom or Dad sitting in there, and eventually Mom and Dad were even saying the words in front of him as well, too. And I would be in conversations with Mom or Dad and be like, F this and screw that and shit and all that kind of thing, blah, 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 blah. And every bad word that we could think of. And was it difficult for him at first? Absolutely. He was not comfortable whatsoever, especially when his mom and dad started saying those things as well, too. He was really begging them not to. But after a while, he was not bothered by them. Now, why did we do that? Because at school, some kids had learned that he was very afraid of all of these words. And what would he do when he heard these words? He would freeze and hold his breath until everybody went away and he could neutralize the word in his head, and then he would start walking again. The problem was the kids at school knew this. And so they would just get him when it was passing periods in the halls. They'd wait till he was in the middle of the hall, and then all the kids would just kind of walk past him and swear, and he would just be stuck in the hall like this. And then he was late for class, and he was getting tardy slips for classes and everything like that, all because he couldn't get to where he needed to go because the kids knew this was going on and thought it was hysterical that they could just say a swear word around him and that he would be frozen in the middle of the hallway. So we had to expose him to these things to get him to the point of no longer freezing so that he would be able to go back to school eventually. And it didn't matter if any of the kids were swearing in the hall anymore. It wasn't going to stop him from moving, and it wasn't going to prevent him from living his life. So that's what we did in that kind of situation. So, one of the things that you'll notice when you're an OCD therapist is you get to do some really interesting things, right? You really get to work with people who are willing to push the limits, and nothing is out of bounds when you get to that point. Sophie says, "Hi, do you have any advice on how to deal with setbacks? I have contamination OCD, and your main compulsions are washing your hands and showering. You were washing faster for a while, but it's gotten worse." Sophie, what would happen if you stopped all of the washing? What would happen if you did only a 15-second hand wash after going to the bathroom and before eating, and then not any other times? Because guess what, Sophie? That's what almost everybody else does. So, Sophie, there's again that part of you that your OCD thing that's telling you specialness is the key. You're special. The rules of the world apply differently to you potentially than everybody else. You've got to do all sorts of cleaning that nobody else would do. And Chrissy says it wouldn't be good enough. You're right. It wouldn't feel good enough. It absolutely wouldn't feel good enough. And that's the whole point of ERP, is getting you to do things that don't feel good enough for your OCD, but are still good enough anyway. Remember, the judgment of OCD is that it's never good enough. There's nothing you can ever do for OCD that will ever actually be good enough, right? So we're not here to try to be good enough in the sense that it satisfies OCD. We're trying to be, flip that around. We're trying to be good enough to be able to sit with the discomfort of I can handle not doing good enough to the level my OCD wants. I can just do things that are good enough for the way everybody else does them. And that's what we really want to do, right? We want to be able to sit with whatever that is and recognize that we can actually handle things being good enough the way it's good enough for everybody else. And not that it has to be good enough for OCD, because frankly, there's no such thing as good enough for OCD. If there was, you would do your compulsions and then you would never have the obsession again, because it would have totally neutralized it, right? So it may sound impossible, but it is not. Even though Ryan's disagreeing with me and saying it is not, because I have treated people for 20 plus years now doing ERP who are doing things now they never thought possible to ever do, but they were willing to sit with the discomfort and take the chance and recognize that, guess what? OCD is a big fat liar. And just because OCD says something doesn't actually make it true. Okay. So that's the thing for all of you to kind of hopefully we can leave you with tonight, is this notion of you can absolutely sit with something that is uncomfortable. OCD does not tell the truth. OCD is not reality. OCD is worst case scenario on steroids. That's what it is. Vendetta says it's pure evil. Yeah. And that you hate OCD so much. I agree. Yeah. It is uncomfortable. It is so uncomfortable, right? And OCD's lie to you is, I've got a way for you to be comfortable forever. Just keep doing compulsions. Okay? Just keep doing it, compulsions. I hope tonight's been helpful for all of you. It's been good to be with you. It's been nice to be back home. Last week I was in a hotel, little out of my element there. Didn't have my theme song last week either. So Paul Amelia, good to have you back with us once again. And yeah, it's been fun tonight. I'll see if we got one more question here that we can find. Oh, someone asked about, why don't all therapists treat people under, David, why don't all therapists work with people under the age of 18? Some people are not kid people. I try to get therapists to work with people of all ages, right? Because OCD is OCD, right? I think the one harder piece for working with people who are under 18 is that you don't just work, of course, with somebody who's under 18. But in a marriage, you wouldn't necessarily work with just the person. You'd have to work with the spouse too, because you've got to bring in the people that provide all of the safety-seeking behaviors into the experience as well too. So if you're under 18, I'm probably going to have to work with your parents, because I'm going to have to train them on safety behaviors and get them to not do the safety behavior provisions that they've likely been doing. So that's important. And I think, David, sometimes it's more complicated, and therefore there aren't therapists who are always willing to do that. But we're really trying to build up more and more therapists, especially here at NOCD, who do child and adolescent work as well too. We've got Dr. Sarah Conley, who's with us, who has great experience in child and adolescent work, and who's doing our trainings and everything. So we're really excited to get more and more child and adolescent work going as well too. So NOCD isn't just for 18 and up, right? We do lots of stuff. So, now I'm getting Doc McIrish. Thank you. Yes, here come the Irish jokes. Well, always appreciate a good Irish joke. Thank you so very much. That's awesome. Sir McGrath. Yeah, awesome, wonderful. Well, thank you all once again for joining. Always good to have all of you with us here at NOCD. We highly appreciate you trusting us as a provider for teletherapy, as a place for education as well. And we look forward to seeing you next week. Thanks, everybody.